Welcome to Georgetown Community Hospital. My name is William Houck, and over the past 8 years, I've had the honor and privilege to serve as the CEO of this hospital. These are uncertain times in the state of Kentucky, in our country, and throughout the world. I'm here today with two messages, two very important messages. One, when you need health care, please seek health care. It is safe. Second, when you come to the hospital, I want to show you, over the next few minutes, what experience that you're going to have, and more importantly, I want to show you all the precautions that we're taking to make sure that you have a clean and safe experience. So come along with me as I show you one of the many reasons why over the past 5 years, Georgetown Community Hospital has been ranked as a Leapfrog Safety Score event. So as you enter the hospital, the first thing that you're going to see is a screening table. And all of our screening tables will be staffed by superstars like Aaliyah Salzman or one of her colleagues. And there's really 4 things that you need to be aware of when you come into the hospital. One, first and foremost, just like when you're out in public, we ask that you please wear a mask. We also ask that you, if you can, to please bring a mask of your own. However, if you do not have one, then we do have one that we can provide you. Second thing that's going to happen, every patient and every visitor that comes through will be given a set of screening questions related to COVID. After that, Aaliyah will take your temperature. Am I good?
Yep, 97.3.
Perfect. And you'll also receive a wristband to show that you've been screened and that you are okay to be in the hospital. After coming through the main entrance and going through a screening, you'll then be called back into registration. Here in registration, a few things I want to point out. One, we have Kim Hayes, who is a superstar. Kim may be the one to take care of you. If Kim won't, then one of her colleagues will. We have plexiglass here. Plexiglass is here to protect you as a patient and also Kim as an employee. And you're also going to be given some papers to sign, consents and so forth. You will be given a pen, and this pen is yours to keep. Sign the papers, return the papers, take this pen, put it in your pocket, it's yours to keep forever. Every patient that comes through gets their own pen. After we leave, or after you as a patient leaves, Kim will then sanitize the office and get it ready for the next patient. We're here inside the hospital, and I have to my right Laura Bills, the infection preventionist nurse here at Georgetown Community Hospital, who I might add is one of the best that we have here, I would say, in the state of Kentucky. And also to her right, again, is Dr. Harrison, medical director for the hospitals program here at the hospital. So, what are we doing to ensure that patients are staying safe in the event they are admitted or they do spend some time inside the hospital?
Well, we make sure that we put on all our personal protective equipment as we need to. We practice standard precautions on every patient that comes in here. We keep our COVID or our potentially positive patients out of the areas where our regular patients are located. We separate our COVID patients so that those get the best care in a secure environment.
And I'll say from the medical service aspect, our internal medicine team and our specialist coverage are staying on top of the latest COVID treatment recommendations. But on top of that, we're still treating patients that have illnesses and surgical needs that come up on an unexpected basis. We're taking just as good a care of them with our standard protective measures as well. So no concerns from that aspect. We're separating those who are potentially sick with it from the ones who are not, but providing just equal care.
Thank you too for keeping us safe, and for all of our employees, nurses here that are keeping us safe and our patients safe as well. So we are here with Angela McDowell, the Director of Women's Services here at Georgetown Community Hospital. So Angela, what are we doing to keep patients, moms, and babies safe?
So first of all, we have a locked unit. Everyone has to be buzzed in to visit us. All of our staff are screened every day before work. All of our patients are screened. We are encouraging rooming in as much as possible. Our physicians are making rounds in the rooms. Hand washing stations have been put in the front of every door. We are to wash our hands in and out.
So what are we doing with mothers who are expecting or in labor, that are having a baby? Are we testing all mothers?
We are testing all mothers, yes.
Okay. I also want to show you 2 of our most important assets and 2 of our most important people here in the organization. Susie and Steve, who you can see, are keeping our rooms and our entire organization extremely clean and safe for everyone that may visit. Dr. Scott Harrison, who is the medical director for emergency medicine as well as the hospitals program. To my right, and then also to my left, we have Jeff Jones-Ritzler, who's the emergency room director here at Georgetown Community Hospital. So, gentlemen, what are we doing here at Georgetown Community Hospital to keep patients, employees, as well as visitors safe here in the emergency department?
Sure. So when a patient checks in, we screen for any concerning symptoms for COVID. We do spot temperature checks and ask a questionnaire about any symptoms, as I mentioned. If they are concerning at all, we isolate them in a room to our best ability and protect them with masks as well as full protective equipment for their staff. During the workup, we maintain that protection as best we can, depending on the situation, and we discharge accordingly with precautions as well to serve our community and any needs that they have. So don't necessarily wait if you have concerns for your health. Get yourself checked out.
In addition to screening all of our patients, we also screen all of our employees daily before they come in with a temperature check. Want to ensure everyone that we have plenty of personal protection equipment that we need in order to take care of the patients. So it is always safe to come into the emergency room.
For taking care of our patients and keeping everybody safe.